COVID vaccinations are strongly advised for most people. In fact, with the FDA recently approving the Pfizer vaccine, some skeptics are feeling a little more confident in getting the shot. However, there are valid reasons many among us are not jumping on the vaccination train, including expectant mothers. Joining us with some insight on what pregnant women need to know is Dr. John Schnoor, fertility expert and co-founder of Coastal Fertility Specialists. It's good to see you again.
Thank you for having me here. I'm glad to be with you guys.
So there's been the rare occurrence of a bad reaction to the shot. There are also some people who have allergies and other health reasons as to why they don't feel they should get the shot. But perhaps you can tell us kind of where patients are standing who are expecting.
Right.
I can imagine they're nervous.
But we see a lot of patients who are interested in building their family, either starting their family or adding to the family. And they have very legitimate concerns about the impact of COVID on their ability to get pregnant in the future, and also the impact of the vaccine to help them get pregnant in the future. And we all know that the vaccine is out and it's helpful to people by lowering their chance of getting an infection. And it appears that if you get infected, you have a lower risk of getting really sick from it. We now have a large number of studies on women who are trying to get pregnant or currently pregnant who get the vaccine. And those studies show that the vaccine, when administered, works within the shoulder where the injection is. The vaccine never crosses the placenta. It never goes near the placenta. We don't think that it hurts the placenta or the pregnancy in any way. As a matter of fact, we think the antibodies that result from the vaccine actually probably do protect the baby and can be protective of the pregnancy. We also think it lowers the risk of a pregnancy, in that if you're pregnant and get COVID, there does appear to be an increased risk of needing a ventilator and having other emergency life support systems being necessary. So our national society strongly encourages all people who are currently pregnant or trying to be pregnant get the vaccine to help protect them.
Is there anything that a patient can do ahead of time just to know whether or not that they are maybe not the best candidate to receive the vaccination?
Yeah, I strongly recommend you sit down with somebody you trust, like your physician, and discuss your symptoms, your health conditions, and whether or not the COVID vaccine would be right for you. And if it is, which vaccine is better for them. They're all slightly different, but so far, when we look at them, we see no increased risk of pregnancy problems, with some very nice, large IVF trials where patients are going through fairly fancy infertility treatment. Those clinical trials show us that if you're vaccinated, you have the same pregnancy rate as those who are not vaccinated. You have the same miscarriage risk as those who are vaccinated between unvaccinated, and birth defect rates the same. So we think that there's a lot of protective benefits without any harm in regards to reproduction.
I see. Any arguments, though, that support someone not wanting to get the vaccination?
Well, I think when I see patients, the most common argument is that we don't have long-term studies on the vaccine, and I completely agree with that. But my reply to that is we also don't have long-term studies on the effects of COVID and its future impact on reproduction. And one example might be mumps. You know, we used to all get the mumps in the olden days, which did have big negative effects on reproduction by hurting the ovary or hurting the testicle. We don't yet know if COVID's going to have that effect. Yet there's been no vaccine in the history of the human species that has ever hurt reproduction. And I think that's important.
Very interesting. For anyone who's on the fence still, what would you advise them to do? I mean, we've been hearing a lot about the mask wearing and certain masks. Experts have been very particular about the types of masks that we should all be wearing. But any other advice that you have for expectant mothers if they just really are not interested or convinced that they should get the vaccination?
First and foremost, talk to a trusted healthcare professional who you as a patient trust and get their opinion on it. If you still decide the vaccine is not right for you, of course, I respect that. That's your prerogative, and I would recommend that you stay at a safe distance from people, that you wear a mask. An N95 mask may be better than some other masks out there. And if you start getting sick, again, follow up with the healthcare provider to see if they can help support you.
And any supplements, any dietary recommendations that you would advise women to take if they were pregnant?
Well, if a woman's trying to get pregnant, we always recommend, a balanced lifestyle, keeping your weight down, prenatal vitamins, maybe vitamin D supplementation. I'm unaware of any supplements that protect against COVID or make it so that you don't need to be vaccinated.
Sure. All right. Well, Dr. Schnoor, I want to thank you so much for your time and
Thank
your
you.
insight on this. Really appreciate it.
Thank you.